Welcome, everyone. As we're gathering today, we encourage you to start the conversation about Campaign for Grade Level Reading Learning Tuesdays. You can follow us on Twitter at Reading by Third and like us on Facebook at Campaign for GLR. Our hashtags are GL Reading and hashtag Learning Tuesdays. We encourage you to use those in any communications that you have. Please share what you're learning on social media. And we'll begin at the top of the hour.
Thank you so much for joining us for today's GLR Learning Tuesdays webinar, Building Towards Scale, the Promise of Virtual Home Visiting. This is the second in a two-part series of webinars on this topic. My name is Sarah Torian, and I'm a consultant with the Campaign for Grade Level Reading, and I will be the host and moderator for today's conversation. But before we get started, I just wanted to go over a couple of really quick housekeeping details. First, I would encourage you to use the chat box function on the side of your screen to introduce yourself. Let us know your name, your organization, and the name of the GLR coalition that you are part of, if you are a part of a GLR coalition. I'd also like to note that we are all in, or that you will all be in listen-only mode to avoid any background noises or distractions during our presentations. But when we transition to the Q&A portion of the webinar, you may raise your hand using the feature at the chat box and let us know if you'd like to speak and actually ask a question of one of our presenters. But I also encourage you to be posting any questions that you may have in the chat box on the screen, and I can pull those from the chat box when we get to the Q&A portion as well. I'd also like to add that today's webinar is being recorded, and we'll share a link to that recording with you after the webinar so that you can share it with others and join in and listen again. But now I'd like to give just a little bit of background information about GLR Learning Tuesdays. As you can see on the screen, we've got a number of great sessions planned for the coming weeks, always on Tuesdays and always starting at 3 p.m. Eastern Time. And we're hoping that this predictable and reliable schedule will make it easier for you and others to make plans to join in regularly for this robust series of online learning opportunities. Having already hosted 8 webinars to date since the launch of GLR Learning Tuesdays in September, I would also encourage you to visit CLIP to find the growing archive of resources from these online conversations, exploring the science, emerging models, and work of leaders in the field. We've got all of the recordings and slide decks from each of these posted there, so invite you to check them out. And then I also hope that you'll continue to save this date and time and make plans to join us for more of these great learning events. Now for today's webinar, as I said before, we will be continuing the conversation that we began last week, exploring the promise of virtual home visiting and scaling the proven practice of home visiting to reach more families in ways that are more convenient and more cost-effective. And for that conversation, we're very fortunate to have Constance Gully join us today. Constance is the president and CEO of Parents as Teachers National Center and has nearly 2 decades of experience in the public and not-for-profit sectors. While leading Parents as Teachers, she has amassed extensive experience directing federal and state education, health, public policy, and advocacy initiatives. So welcome, Constance. Thank you so much for joining us today.
Thank you, Sarah. I'm excited to be here. Thank you for this opportunity to share this important innovation.
Wonderful. So, Constance, before we kind of get started delving into the potential and promise of virtual home visiting, I was wondering if you could provide us with some grounding on home visiting in general. Why is this type of early support so important for families, and what does this support actually include?
Oh, well, great question. And I do think, I agree, it's so important to start with the why, and why the early years matter. So we know from research that 80% of rapid brain development happens in the first 3 years of life. And you can see in the illustration, the left illustrates the brain wires at birth, and the right is at 6 years of age. So most of that is happening during the first 3 years. We also know that nurturing conditions and supportive parents and caregivers can make a huge difference in what it takes for children to thrive. So you can see here, this tree is nurtured in wonderful conditions, but by the same, in the same fashion, children require conducive nurturing conditions to thrive. And parents as teachers, and home visiting overall is a strong strategy and intervention to help parents get what is most important to them. Every parent wants what's best for their child, regardless of the zip code or where they live. So what is parents as teachers? When we consider home visiting overall, there are 20-plus models on the Home V's evidence-based list for HRSA. Parents as Teachers is an evidence-based early childhood home visiting model designed to provide support to parents during the crucial early years of life. We serve mothers during pregnancy all the way through kindergarten, and we work as a model with the entire family. So all caregivers, moms, dads, grandparents, any adult that has the opportunity to engage in a child's development can participate in a Parents as Teachers visit or group connection. We're backed by 35 years of research and recognized by multiple evidence-based clearinghouses with outcomes reported in some really key areas, including increased parent knowledge, parent practices, and engagement both in schools and communities, increased children's school readiness and later school success, including improved kindergarten readiness, 3rd and 6th grade reading levels, improved attendance, and reduced suspensions. Another important outcome is the early detection of developmental delays and health issues, and positive child health outcomes such as a timely recommended well child visits and immunizations. Another important and key outcome for the Parents as Teachers model is the reduction and prevention of child abuse and neglect. When we consider the footprint of Parents as Teachers, once again, we are the most highly replicated evidence-based home visiting model, but because we have a model that's designed to serve all families, we are often implemented side by side with other evidence-based home visiting models to get a broader reach. We started right here in Missouri, and we're now offered in 50 states, 115 tribal communities, and 6 other countries through local implementing agencies across multiple sectors, including school systems, hospitals, federally qualified health centers, housing authorities, child welfare agencies, and it basically runs the gamut. Any entity that has an interest in improving the lives of young families and children can utilize Parents as Teachers as a strategy to positively impact families in that community. Annually, we serve nearly 190,000 families and over 225,000 children through our evidence-based model, as well as other evidence-based models that subscribe to the Parents as Teachers curriculum. Our home visiting model, once again, is designed to serve any family, but typically, communities and funders determine the populations to be served, usually with an emphasis on families that may be experiencing poverty or a multitude of other stressors. Nationally, 80% of parents as teachers, families reach have at least one or more stressor, such as a history of child abuse and neglect, teen parents, low educational attainment, depression, housing instability, or children or adults with disabilities. And 51% of families served by parents as teachers report having 2 or more stressors. At the national office, we are the model developers. We also have a network of trainers and a trainer certification process that currently deploys more than 70 trainers across the country. So parents as teachers is also an easy model to scale in any given community. We have an implementation support system that provides technical assistance and support to 1,200 plus local implementing agencies that we refer to from the National Center as our model affiliates. And once again, we have an online, robust, evidence research-based curriculum that also supports our home visitors and families. That curricula is used by all programs that implement the parents as teachers model. But what's interesting is we also have curricula that is adopted by other evidence-based models and family support organizations that are providing home visiting or other family support services. We also, from the National Center, monitor a system that is set up to track quality and fidelity of implementation of the evidence-based model, that is parents as teachers. Our home visitors meet with families a minimum of monthly, most commonly twice per month, and sometimes weekly, depending upon the needs of a particular family. And we do this through the interaction of the 4 components of the model. And personal visits are the heart of the model, where our parent educators partner with parents, partner, facilitate, and reflect to help parents understand their child's development, address developmental topics like sleep, nutrition, routines, and more. We also coach parents on positive parent-child interaction. We share different activities that the parent can do in the home to interact with their child and support their development. We also work with families to set goals and help them create a plan or plans to achieve those goals. Developmental, social, emotional screenings, as well as health, hearing, and vision reviews help parents identify possible concerns so families can be linked to the appropriate services and such as early intervention, which leads to the 3rd component of the model, or resource referrals. We identify and connect families to community resources and services like housing and food assistance, diaper banks, and help families establish a medical home. The 4th component of the parents as teachers model is group connections or group socialization, where we bring families together around specific topics that are led and selected either by the family or by particular concerns or the voice of any given community. Once again, I think that it's important to note when we talk about group socialization, oftentimes vulnerable families tend to lean toward social isolation. So these group connections give families an opportunity to develop social networks as well. It's a pleasure to be here. We have this long history of parents as teachers of adapting our services to a changing world, and we're excited to be on the forefront of developing a virtual home visiting implementation across all components of the parents as teachers evidence-based model, but with learning that can inform all home visiting models as well as other family support programs and professionals. So it's a privilege to be here, but that's a description of parents as teachers, the model itself, and home visiting in general. Our model is often implemented alongside several other models. A great example is New Jersey, a state where in 21 counties our state office implements parents as teachers, alongside Healthy Families America and Nurse Family Partnership. So parents as teachers, along with the multitude of home visiting, evidence-based home visiting models across the country, are encouraged and excited about this opportunity to pursue virtual home visiting as a strategy. But I'm most pleased today to introduce the content and implementation experts who have the most insight here. Angela Rao is our virtual parent education specialist, as well as a national trainer. Allison Kemner, our Vice President of Research and Quality, and Donna Hunt O'Brien, our Vice President of Professional and Program Development, are all great leaders right here at Parents as Teachers National Center. And these three are the original trailblazers alongside Dorian Traub at USC and their telehealth clinic. They are the trailblazers behind this work, and they really do have the answers to the questions that you'll be asking this afternoon and the insight that I think will be most beneficial. So thanks again for the opportunity.
Thank you so much for that, Constance, for the great overview of parents as teachers and the benefits that home visiting provides to families, and for introducing your amazing team of trailblazers. So welcome, trailblazers, Angela, Allison, and Donna. Thank you so much for joining us as well today. Angela, I was thinking we could start with you. So understanding the benefits of home visiting, as Constance just outlined for us, how well are we doing in ensuring that all who could benefit from these supports are actually receiving them?
Great question, Sarah. We are constantly at Parents as Teachers holding in mind how we are reaching families and finding new ways that we can reach families so that they can benefit from home visiting. Evidence-based home visiting models are reaching many families across the nation. Families are receiving high-quality parenting support through home visiting in many areas across the country. And this map shows where national home visiting services are available. It's based on data from the 2018 report from the National Home Visiting Yearbook, and it shows the reach across all the evidence-based home visiting models. All the evidence-based home visiting models are reaching around 304,000 families. And we know that's a lot of families, and yet we know it's not enough families. Parents as Teachers being widely replicated as a model is serving about a third of all the families of that 304,000 families, and is reaching 8,000 zip codes of the 42,000 zip codes in the nation. And this isn't all the families in the zip codes. So you can see there are many families who do not have access to home visiting. And in fact, we have home visiting deserts, and we want to address that. We know that there are 18 million pregnant women and families that could benefit from home visiting, and 9 million have 2 or more stressors, as Constance shared. And these stressors can include low education, housing instability, a parent or a child presenting with a disability. So the need is there. We have some challenges in reaching families. We're noticing that even in states and communities where services are reaching families, there's a need to reach those that are underserved, such as immigrant families or families with low literacy or have limited use of English, families that are socially isolated or living in poverty. We are also noticing in the field that states and communities are telling us there's a shortage of trained workforce that hold a knowledge of child development and family support, and also the skill of coaching family goals. And programs are sharing that they're needing support with identifying home visitors that reflect the culture and speak the language of the families in their community that are underserved. This is particularly true of families who do not reflect the majority of members in a community. Reaching families where they are at is the special part of home visiting. To gain, it helps us gain the greatest outcomes, and it helps us get to families where they're at. However, it's costly, and a strength of home visiting is that families do not have to travel to an unfamiliar office to receive support. Home visitors come to families. With that said, in some cases, home visitors travel through intense traffic, intense weather, long distances to visits and from visits, even when families show or don't show. We're also seeing that many states see the benefit of implementing home visiting statewide. However, coordinating and distributing services across their state's geographic boundaries is somewhat of a challenge. And some communities that have the most need, states are needing innovative ways to reach families in these pockets.
Sorry. So, Angela, given the coverage gap that you've just described and the challenges that we face in closing that, where do you see the opportunity to leverage technology in closing those gaps?
Closing the gap and noticing this opportunity is where the opportunity is exactly our motivation. Over the years, we are noticing the gradual integration of technology assisting services. Today, home visitors and families are using a variety of services assisted by technology to connect and share and retrieve information, timely information. Now, our home visitors and families are available to each other through cell phones and texting in real time. This continuum shows the range of low technology use with on-ground child and family support services, to services assisted by technology, to services delivered through technology. I just want to take a moment and share some of the statistics that the Pew Research Center shared in 2017. And it showed that 95% of adults in the United States have a mobile phone, and 77% own a smartphone. Now, you might be thinking, well, what about low-income adults? Well, the Pew Research Center showed that low-income adults are indicating that 92% of these adults earning less than $30,000 have a mobile device, and 64% have a smartphone. And this is coming true out in the home visiting field. Home visitors are sending parent-facing materials through email and texting, and families are using parent-facing apps, and some families are reaching friends and family members through FaceTime or Skype. And families are managing their healthcare through portals and retrieving social connections through social media. Mobile apps are a standard use, and they're supporting families and programs, child care centers, home visitors. And this is offering families screening tools and information, and offering professionals ways to track observations and parents to track observations. We're also seeing that programs are using social media to engage families, and websites for recruitment, enrollment, and distributing information. And innovators are also heavily engaged in this work. The Statista.com shares a statistic that there's an average of 6,000 plus mobile apps every day being presented to the user market. So technology is integrated in our work. The headline here is that many parents and organizations who use technology and access the internet do so on a mobile device. Technology is so integrated in our lives, it is a social norm. And we're seeing organizations are noting how their families are using the various technologies in their daily life and planning strategies to adapt their services. And in parallel fields, healthcare, early intervention, and education, they're offering services delivered by technology to reach more families who need their services. For example, telehealth is becoming an increasing healthcare norm. Telehealth connects patients to vital healthcare services through video conferencing, electronic consults, and wireless communication. A 2018 statistic showed that 76% of US hospitals connect with patients at a distance through the use of video. We're using this opportunity in providing virtual access to home visiting as a way to leverage known telehealth practices to deliver services in real time. So virtual home visiting, the innovation that we're bringing out, is using secure interactive video communication, and we're kind of calling that IVC, to deliver home visiting at a distance by connecting home visitors to families. Parents as teachers at USC Telehealth pilot program used full technology. Supervisors, home visitors, and families all connected 100% virtually. We're now bringing our learning from the USC virtual program into another format called hybrid, partial on-ground access and virtual access to home visiting. My colleague Allison Kemner will explain this integration of virtual and the benefits of full virtual in a few moments.
Thanks so much for that, Angela. So yeah, I'd like to turn to you now, Allison, if you could. Angela really kind of presented both, you know, the coverage with parents as teachers and the opportunities, different types of approaches for technology-assisted continuum. Can you tell us a little bit more about what those various options along that continuum might look like? Could you help us dig a little bit deeper into that?
Sure. Thanks, Sarah. So I'll focus first on talking about the full technology use. And as Angela mentioned, that was our project, the Parents as Teachers Telehealth Pilot. And this was showcased on the previous Learning Tuesdays webinar, if you haven't had a chance to see it, and I'll mention where that link is later. With this pilot project, our team at the National Center partnered with Dr. Dorian Traub from the University of Southern California and the School of Social Work to pilot and test the feasibility of delivering the Parents as Teachers model virtually through a telehealth clinic. Recent research on telehealth and its use within early intervention and mental health really informed this pilot project. And through this project, over a 3-year period, we served 229 families, and they received all their services virtually. We did demonstrate feasibility of delivering all 4 components of the Parents as Teachers model that Constance mentioned earlier: home visits, group connections, child screenings, and resource connections. We learned about desirability. Families reported satisfaction with services, responses ranging from 89% satisfied with overall services to 96% satisfied with their home visitor. Some additional program findings included that we learned about family recruitment and successful social media recruitment strategies. We tailored our training and implementation support and supervision methods that were needed to deliver the services virtually. Additionally, we created access to parent materials from our web-based curriculum in a website portal for families to reach in and access themselves. We also identified the proper environment and practices for equipment and placement within the virtual home visits. And finally, through this project, parents reported improvement in their parenting and well-being. So some statistics on that: 91% felt the program increased their understanding of child development. 87% of participants felt motivated to try new parenting strategies, and 96% of participants felt that their home visitor identified their family strengths. Our findings through this pilot were relatively consistent with another recent study published in 2019 that investigated the perceptions of family that participated in early intervention telehealth services. So we're seeing some parity between early intervention and now within home visiting. So within that study, they found that parents appreciated the flexibility, and it created increased access to care for families where oftentimes provider shortages may exist. And telehealth practice heightened family engagement and the uses of coaching practices, which we also saw a lot, the importance of the coaching role that the home visitor played because of the technology. So to help paint a picture, I want to share a story about some of this work. Jessica is a bilingual virtual home visitor. She is married to a soldier in the Army and lives in the community next to the base. They have a preschool child who is receiving early intervention, so her working hours are structured around her child's school hours. The virtual home visiting position provided Jessica, a home visitor and a busy parent, with flexibility. So that's addressing the workforce piece. Louisa, a mother, learned about home visiting services in the hospital after the birth of her second baby. The Los Angeles Best Babies Network hospital navigator told her about the virtual services. They were a great recruitment agency that we worked with. And virtual home visiting services were offered when families didn't have access to home visiting in their geographic catchment area within Los Angeles. So I want to share 3 ways in which virtual home visiting helps Louisa and share how virtual home visiting is similar to on ground. During one of the first few visits, Louisa described to her home visitor that she was concerned that her son was not sleeping through the night. A child development screening indicated his development was not progressing. Jessica prompted Louisa to find a healthcare provider close to her apartment and referred her to the LA Regional Center, where he is now receiving early intervention. Jessica asked Louisa to take a stress assessment, and those results indicated that she was feeling a lot of stress. They had some conversation, and through further dialogue, Louisa shared that her lease on her apartment was up. She needed to find another place to live in LA, and soon. Jessica and Louisa discussed options, and they made a plan. Louisa found a place, however, it was located 35 miles from her current home. Jessica and Louisa kept their visit schedule throughout Louisa's housing transition. In an on-ground scenario, moving may have impacted Louisa's ability to continue services, but virtual home visits have no boundaries. This story helps to demonstrate how virtual home visiting supports families. To learn more about the Parents as Teachers at USC pilot project, you can visit the website to learn more. We also have a prior webinar, as I mentioned, the Learning Tuesdays, and you can advance the slide. Thank you. You can see the prior webinar link is embedded here, so you can access that, as well as the website to find more information. There's also a published article that highlights some of the research, and we're looking to publish some more work on this work. So it's very exciting. And then as we kind of look ahead, Angela referenced this hybrid approach. So through this work, this partnership with USC, we're really now positioned to further understand how virtual services can work to support our on-ground affiliates. We're taking the learnings from the Parents as Teachers at USC pilot that took place in an incubator environment within the USC telehealth clinic, and we're applying learnings to the real-world settings to look at viability. This project would be a hybrid. It would use a combination of on-ground and virtual visits using interactive video conferencing. Many of our states and communities are looking for innovative ways to meet families where they are. And our network of more than 1,200 organizations have been inquiring on how they can use virtual to support families. So what we're doing is we're currently recruiting programs from our existing network that have already demonstrated quality implementation of the Parents as Teachers model to participate in this hybrid project. The research project I mentioned earlier that looked at telehealth within early intervention that research concluded that there is a need for more research on hybrid approaches, and that's really exactly what we're seeking to do here. While we're just getting launched with this hybrid project, we thought we would lift up a few key research questions we're looking to investigate over the coming years. We're looking at what types of organizational infrastructure and supports are needed in order for local implementing agencies to assess their readiness. What are successful strategies in determining family readiness to receive virtual services? We're continuing to refine our professional development on virtual service delivery to emphasize key skills needed by home visitors and supervisors, coaching being one of them. We also want to understand how this hybrid approach can support family engagement. Are there differences in the length of time families may stay enrolled? And how do parenting outcomes differ when families receive a portion of parents as teachers on ground and virtually compared to on ground? And are there differences that we see among families and their characteristics? So what works for whom? And finally, what types of program efficiencies exist within the hybrid? Are there cost savings from travel, increased caseload sizes? So as the model developer, we value quality implementation of virtual services, and interested local implementing agencies will work in collaboration with Parents as Teachers National Center on looking at implementation and evaluating the impacts of these efforts. So to kind of break this down and give a case study scenario of what this could look like, here is a picture of some of our wonderful home visitors and supervisors from 2 local implementing agencies in Wyoming, and they're currently delivering the Parents as Teachers model on ground to 267 families last year. In Wyoming, there are families served across 4 large counties, and we know that some families could have compromised immune systems and could benefit from virtual services to provide support to them. We know inclement weather may also be a challenge. Wyoming has treacherous winters with the snow, which could cause cancellations, and similar scenarios exist across the country in terms of those natural disasters. There's also places in Wyoming, as in most places in the U.S., where there might be the perception of safety may be an issue, and a home visitor may not feel comfortable going into that community. So oftentimes, particularly for these home visitors in Wyoming, they're traveling anywhere from 1 to 2 hours one way to deliver a home visit. So let's imagine if virtual home visiting was an option to allow these home visitors to meet with the families once a month virtually and once a month in the home. Using a hybrid approach would support local implementing agencies similar to those in Wyoming in meeting family needs and addressing programmatic challenges. Through this hybrid project, we will understand potential program efficiencies with the goal of providing quality and accessible services to families.
Thanks so much for that, Allison. It was wonderful to kind of see and hear the stories about what this really actually looks and feels like in these different types of options. And yeah, thinking about the way it's breaking down barriers around transportation and the distance to travel to get to folks is really powerful. I'd like to transition now, if we could, to Donna, bring you into the conversation. I understand that you had an opportunity to focus your work on the program component of screening and assessment through an award from Gary Community Investments and Open IDO. Can you share what some of the key learnings were that came about through that process with us?
Yes, Sarah, this really was a wonderful opportunity. Thanks to Gary Community Investments and the Pittman Foundation, we've been able to take a closer look at one program component to identify best practices in virtual service delivery. But we're also motivated by the recent statistics that only 30% of our nation's 9 million children ages 9 to 35 months have received a completed developmental screening in the last year. And even more, there's a poor correlation between screening and early intervention services. Now, we certainly believe that, along with increased access to screening, intentional family engagement and empowering families with their own data is needed to move the needle on connections to prevention and intervention services for children. This project award gave us wonderful access to Open Ideas networks and coaching from Promise Venture Studios, which really upped our design game. Our solution is to leverage interactive video conferencing to increase access to screening and to identify the elements of child screening experience that could be added or enhanced to dramatically increase parents' actions. And this human-centered design framework helps us to remain grounded in the experiences of practitioners and families, to prototype and test, and to evolve with feedback and learning. And we began with consulting with experts and interviewing parents and surveying home visitors. And our idea was also informed by recorded virtual screening sessions. So through some of the parent interviews, we learned about the family's experiences with screening and assessment, where they took place and who administered them. And we heard from parents and learned that many of them were not told the reason for a screening or assessment, and even fewer of them had received an explanation of the results. Most parents were interested in this information, whether or not there was a concern, and they also wanted to know what to do next. With home visitors, we mentioned surveys, and with parent and practitioner permission, we were able to record virtual screenings. There was a lot of observation here, and during our investigation, we identified a lot. First of all, 3 phases of the screening experience. It's not just a one-time event. There's initiation, there's the actual screening taking place, and then there's making meaning of the results and taking action. We learned a lot about the fears that practitioners have around screening and the areas in which they felt less confident. And we identified essential skills and behaviors that actually validated our earlier observations of the importance of coaching in virtual service delivery. And in this, clarified a coaching process specifically for screening, engaging families through the entire process, empowering them to collect, understand, and use their data, and provide them support during the screening event to help them interpret results and prompt a plan of action and connection to resources. Parents want to use what they've learned about their child or themselves through assessment, but often need support and encouragement to design an action plan to advocate for and to navigate service systems. So now we're in an implementation phase of this project. And with a goal of engaged and empowered parents who take action informed by their screening results, a training was developed and piloted within our Parents and Teachers USC telehealth affiliate. Post-training, we found shifts, good shifts, positive shifts in home visitor perspectives, values, behaviors, and even coaching skills. The learnings from this focused study and ideation can also improve the efficacy of on-ground screening and assessment. And to support these quality screening and assessment experiences in the field, we're developing implementation guidance, professional resources, and parent-facing materials. We're also exploring other uses of screening apps and considering the added value of wrapping them in a coaching relationship. There definitely are limitations. Virtual services won't be a fit for everyone. They're not going to solve all the access issues. There are still problems with connectivity, as you know, in many communities. And the social norm for virtual services is just emerging. We found that we had to educate community recruiters about how it would look and feel to participate in virtual home visitation before they were able to successfully recruit families for us. And there isn't a readied workforce for delivering services virtually.
Thanks for that, Donna. It's wonderful to see kind of the opportunity, but also being realistic about where the limitations and barriers to moving forward with this are. I was wondering if you could also share, what is the potential for leveraging this type of technology to enhance other types of programs and efforts? What do you see there?
Well, there's no doubt that the best practices of virtual service delivery can be infused into many service sectors. The potential systems impact is vast. It adds another pathway for professionals to reach families in healthcare, home visiting, early intervention, early care and education sectors. And learning how to provide services virtually will enable our workforce to serve today's and tomorrow's families. As a result of the work in our Parents as Teachers USC telehealth affiliate, 20 home visitors are now experienced in virtual service delivery, and they are a flexible future resource. We are currently developing an online training to support the field in virtual service delivery. Also, tech-assisted service delivery practices apply cross-sector. Like our examples in screening, they can enhance the agility of a program and a community to meet their family's needs. But mostly, virtual service delivery is a family engagement strategy, one that can complement most programs and reach families who are mobile, have social anxiety, are medically fragile, or who mistrust systems, or are just busy. We have applied our family engagement values to this work, and we actually have a book, plug, on Amazon called Engaged, if you'd like to learn more about those values. In a moment, there'll be time for questions, but now I would really like to invite you to imagine how virtual service delivery practices could be infused into your program and support family engagement.
Thanks for that, Donna. I wanted to give everybody a moment to reflect and imagine those opportunities for their work. Now I'd like to move back to you, Angela, if we could. Can you share a little bit about what Parents as Teachers is doing to continue to expand this work?
Sure, Sarah, thank you. You've heard such great information from my colleagues. You know, the Early Learning Labs put together a quote here that I think really summarizes our effort, is that there may not be a single solution that'll meet the needs of families at scale. And we need to think expansively and creatively about how technology can be used. And here, and Parents as Teachers, we're seeking partners and stakeholders and champions to participate with us in taking the incubator learnings that we got from Parents as Teachers at USC Telehealth and expanding it into real-world settings. We're interested in certainly the hybrid method, we're interested in full implementation, and we're interested in taking specific service delivery modules such as screening and others and doing additional implementation and evaluation around this work. So we really invite you to connect with us, join us in dialogue and creation. And we really want to thank the Campaign for Grade Level Reading for giving us an opportunity to talk about this. We do want to provide you our contact information so that when you're ready to have a conversation with us, we're ready to sit down and talk with you.
Thank you for that, Angela, and thank you for all of our presenters today, Constance, Angela, Allison, and Donna. We'd now like to open it up for questions and answers, and actually before we do that, I'd just like to remind everyone we've got the great contact information and the invitation from our friends at Parents as Teachers National Center to reach out, and wanted to share that everybody who is registered for today's webinar will be receiving a follow-up email in the coming week or two that will include all of this information. It will include links to the reports that were referenced, to the book that was referenced, and also the contact information so that you can follow up if you're interested in learning more about how you, your organization, or your grade level reading coalition could be a part of this work and kind of explore these opportunities with Parents as Teachers. Now, we've gotten a number of questions from folks who are on the call with us today, and I'd like to remind if anybody would like to ask their question or share a comment on their own, you can raise your hand using the chat box and we can unmute you if you'd like to. But first, I'd like to start with some of the questions that have already come in. One is, can you describe how state agencies that fund and monitor home visitation implementation can be a part of this virtual home visiting research study? You mentioned, I know, in New Jersey that there are a number of different home visiting programs that are supported kind of in all 21 counties in the state. Where's the opportunity or potential for connecting with 8 state agencies that are supporting home visiting and exploring these research questions with you?
This is Constance. Can you hear me? So I think for state agencies that have resources for innovation and evaluation, they can identify quality on-ground programs that they can lift up to participate in the pilot and fund the implementation that they're already funding, as well as evaluation of the work.
Thank you. Anything else?
Yeah, this is Allison. I just want to add, I think, so that's kind of addressing the hybrid model. But I think, too, if there's a state entity that sees that there might be gaps in services within their community, what Angela was referring to as home visiting deserts, and there might not be services in that area, is that an opportunity, and would the state be willing to fund both an implementation and a research project to look at the impact of the full model, so replicating what we did with the USC telehealth project. So I think there's opportunities both with the hybrid and the full virtual in terms of implementation and evaluation.
Great, thank you. So for those who might be interested in kind of adopting either a full virtual approach or integrating technology into their existing home visiting programs, what can you share about what it takes to get staff ready to make this transition in service delivery? Were there any kind of, what did it take for you at Parents as Teachers National Center, and what do you know about what it takes for an on-the-ground program to make this transition?
Yeah, I'll go ahead and jump in, and Donna, feel free to jump in after if you like. Well, one of the things that we were so blessed in having an opportunity to be in partnership with the USC in their telehealth clinic, and so we were able to leverage the telehealth clinic training, and we learned many things. Several. What are some of the secure ways that we need to be interacting with families? What type of platform, what type of ethical and behaviors do we need to have when providing virtual visits? We are taking those learnings and turning them into a training to expand out into the field. I would hold that in mind, a secure platform if you are looking at that. I would also hold in mind the environment in which you're delivering the virtual visit, where in video conferencing it can happen almost anywhere, and we certainly don't want to be providing services in Starbucks or McDonald's. And so, I think those are obvious things, but there are some specific guidances around that. The other thing is that we really noticed something that is definitely we would want to have in on ground is very good, sophisticated, strong coaching skills. However, in virtual, you really need to have good rapport and communication skills. And so I would be shoring up your staff in those skills because you do not have your physical body there to be able to move around. So you're really wanting to optimize your communication and your coaching skills in this platform.
Thank you. That's helpful. Good points to think about. So for folks who are on the call who might be interested in working with parents as teachers in implementing some of these hybrid approaches, what would be a next step?
So this is Allison. I can take this and others can feel free to jump in. So with our hybrid evaluation, what we're looking to do is we're looking to recruit existing parents as teachers, local implementing agencies, and working with those that have demonstrated quality because they already have the infrastructure in place to deliver parents as teachers, and working with them on this hybrid approach, so using both the on-ground and virtual services. So that will be part of our approach, is working with our existing network. And then we're happy to share what, we'll publish and share our learnings from that and consider how it could apply beyond into other home visiting models.
Anybody else want to chime in on that question? So in the presentations you mentioned,
well, she's the point of contact for programs. And then I think that for those that may not be aware of a Parents as Teachers program in their community, they can also reach out to the National Center to identify programs, because with I think Angela mentioned earlier, we're reaching about 8,200 zip codes across the country, but there is no zip code that is reaching 100% of the families within the body of those zip codes. And then there are also opportunities for existing programs to expand their reach from their on-ground
like
to
early.
broaden the services.
Mm-hmm.
So somebody's asking that, if they're having discussions with their local affiliates who are interested in this, and if there is buy-in for doing something like this, who would be the best person to contact? And this could be something that we could include in the follow-up email, but it would be great to let folks on the call know that as well.
Yes.
I would say, Allison or Donna or Angela. So they can connect to any of the three on the call. They can reach out to me also, but I'm going to reach out to one of those three to follow up. But I do think that we are well positioned to move interested programs and funders forward in the work at this point.
So do you have a sense yet of what the cost and the administrative lift would be in implementing something like this, whether it's a hybrid approach or the fully virtual home visiting approach? Do you all have a sense of that yet?
This is a question that we often get, and it is something that as we add more implementation projects along, we want to answer. One thing we do know in implementing at Parents as Teachers at USC is there are some standard things that are additional costs to a typical on-ground, and that is making sure you have a video conferencing platform. That is when getting any documents signed, you're using a software. We used DocuSign, and you're getting some electronic signatures. We at Parents as Teachers at USC, what we did was for some engagement methods, we sent some materials through mail to parents. It's not necessary, but it was something as a nice parent engagement thing for us to do, because mainly we used a lot of the materials that were in the home, but families love to have books, and families love to have materials that create some interesting. If anybody's interested, I would love to show you what we called our parent kit. We designed it in a white box and then encouraged our parents and children to decorate it and make it their own. But that was just a nice engagement strategy, as Donna was talking about. Other costs, we're seeing in home visiting already. Home visitors are using internet, and they already have devices, because in parents as teachers, we have a database. They're collecting their data and recording it, so they already have that technology. Our home visitors are very comfortable with that. If you're reaching out to families that do not have devices, and that might be part of a research design, you might add that element to the implementation. If you listen to the previous webinar Dr. Traub shared, you would have to be aware that if you're providing a device to a family, we quickly learned that it didn't matter how resourced the family was, we were not getting our devices back. So I'd encourage make a friend with some internet provider, and maybe they could provide it for you for free, and that won't be a cost. But those are some of the general costs that are just add-ons to a typical on-ground.
Would anybody else like to chime in on that question? Or should we move?
Those are add-on costs, but then for a new affiliate program or an existing program that is scaling a carve-out for virtual, we have budget tools that they can use based on how they intend to scale, so the cost for the staff that they intend to hire, and we can also help with the support system, because we already have an on-ground implementation support structure at the National Center, but then we have the additional resources that will be provided for programs that are implementing virtually to ensure that they have a clear understanding of what needs to happen as they proceed with the implementation.
And is this something that would be, in thinking about cost and earlier sharing about the transportation, the travel time that's required to reach some families, and the transiency of population and staying connected with them, is that a research question that you will be tracking in terms of the possible cost savings to affiliates or programs in terms of the staff time required to get from A to B, those 1 to 2 hour drives? Is that a part of the research study?
Yes. So we're seeking program efficiencies. So there might be efficiencies beyond just cost and travel that we're looking at. But we anticipate that we might see that some home visitors are able to increase their caseload and serve more families. So we're kind of seeking to explore that, and don't necessarily have any, we have some hypotheses, but going in kind of open-minded to understand what the potential is there.
Okay. So someone is asking if parents as teachers would consider working with agencies to try innovative approaches through virtual delivery, maybe such as doing universal screenings, but not doing long-term home visiting for all families. So reserving long-term home visiting for only some of the participants who are deemed to need it. So maybe a light touch and deeper touch with different families. Is that something that you would be interested in exploring?
Yes, this is Donna. We definitely see a lot of application, and from what we've learned, we would love to have further conversations with individuals and support with what we know, but also help individuals come up with solutions for the things that they're facing. It's screening. We gave you a good example of everything we've learned about screening, and we've also talked amongst ourselves about things like fee-for-service and serving families with less challenges, and so we're open to all those conversations.
So you mentioned that the social norm for virtual services is something that's still emerging. How do you all envision virtual services becoming more of a standard social norm among parents and professionals in the future? And what do you think is what do you think will move the needle towards that, in your opinion? Any thoughts?
You know, I think this is an interesting, this is an interesting subject because when we first started in this work, we quickly realized that virtual service, when we were describing it in LA to to the community of LA, it was hard to explain. But telehealth is becoming more and more of a social norm. I recently heard that there are some Walmarts that are offering telehealth. And the more that telemental health, early intervention is becoming integrated into healthcare, I think the easier it is for us in a sister sector to be able to implement, to help it be a norm for families. As home visitors, though, and supervisors, we now need to step in to be ready for that. Healthcare providers are taking professional development around doing telehealth practices, and what are some of their guidances around that. And I think it's time for us to step in. We also found in our affiliate that the families that came in that were receiving our virtual home visiting were more likely, if they showed a need for some mental health support, to access telemental health. And so I think it's also an opportunity for telehealth. There's some areas around telehealth that maybe families are not accessing that could access telehealth, and virtual home visiting could support it being a common practice in a family system. When you have 3 children and one that was really ill and you can't get out of the house and you need some support, it'd really be nice to have your virtual home visitor come in. It'd be really nice then to be able to access your pediatrician, so you could see this really would support the family routine.
Have you all explored any doing virtual screenings for prenatal mothers? Or do you have any specific screenings or assessments that you know work well virtually during the prenatal phase?
At Parents as Teachers at USC, we did have families coming in prenatally, and we did use some stress assessments, and we used that through electronic links, so families were able to take the assessment. The home visitor was able to score it and then have a conversation with families, with the parent, and what their needs were. We definitely think prenatal is a really supportive way. The national effort around maternal morbidity and mortality, and we think that Parents as Teachers curriculum is really strong in the prenatal area. Virtual could be a great way to build rapport with a family, to meet them where they're at, and then do something like a hybrid method where then when the child's born, move into an on-ground. So we are seeing lots of different, a tapestry of ways to put it together. And so as stakeholders and those interested in the field, you watch and see what your community needs. Come have a conversation with us, and we'll partner with you to make that happen.
So we've gotten a couple of questions that are kind of looking at how this changes the practice, or how this is different from on ground doing the virtual model. Somebody's asking about, when you're using technology for visits, how does this change the policy of the face-to-face visits that parent educators currently adhere to? And then someone else is curious to hear about how you can do that modeling with families when you are visiting them virtually rather than in their home.
So this is Allison, and I can take the first part of that question, which is about existing parents as teachers affiliates and how they could, use the hybrid approach within our policies. So right now, the hybrid project is still very much a pilot. So we're taking the USC pilot, and now we're kind of transitioning from a full virtual into a hybrid pilot. So really, parents as teachers of programs that are interested in doing that need to be in touch with the National Center and work with us on that research project. We're going to be working alongside Dr. Traub at USC to continue that relationship. So the policy right now is that really the on-ground visits still need to take place, but we are really seeking and hoping that this pilot will show that there's a place in which virtual can support that. So I think if they're interested, definitely, as Constance said, reach out to one of the three of us, and we can continue those conversations.
Thank you.
I think there for the, I'm sorry, did you have a follow-up?
No. Go ahead, Donna.
I was just going to take the other side. Thanks, Allison. I think there are a couple things listed up there. One was around modeling. I'm also seeing in the chat thread what might go with this is just the trusting relationship, and is that going to work? Is this a real thing that's going to happen? And that's where I can say the feasibility that the study we did around feasibility really played out. Now, what Angela and Dorian and I saw and Allison saw early on was we watched video of early interventionists, like occupational therapists, coaching parents to do occupational therapy with their child. And when we saw that, we were like, that's it. Like, we can coach parents on parent-child interaction if this can happen and it can be effective. And so what we figured out early on, as Angela was saying, is that families are already creating and holding and sustaining relationships using interactive video conferencing with grandparents, with spouses that are deployed, with all of these individuals that of whom which they want to remain in close contact with. And this is a model that's being implemented, it's just being experienced through another system, but it is face-to-face, and it is real-time. And that is what we saw really happen. Now, are there a couple of skills and strategies that are different for a practitioner that is working across this particular medium? Absolutely. And that's where we were focused in a lot of this work and what we're identifying and being able to be put in training. Coaching is a big part of it. Demonstrating things for families is also something that's possible. I know that the home visitors at USC had baby dolls, but one of the things that they were really careful about was was making sure that they were supporting and teaching the parent so that the parent could then use those strategies with their child when they were demonstrating some of those.
Thank you. So we've gotten some questions about kind of that family recruitment and how you're using social media to do that. What can you share about, in terms of the learnings about best practices or what really works in recruiting families and using social media? We've also had somebody share that a lot of the families that they serve can't afford a phone, but they do have access to social media, and so that's one of the ways that they are engaging and reaching families. So what can you share, or what have you learned in terms of social media strategies to support this work?
Yeah. So Amanda Taylor, our supervisor at Parents as Teachers at USC, spoke about that in the first webinar. So some details to that. I encourage you to listen to that webinar, and then if you want some specific data, we can share, we can have conversation offline. I can give you some broad things. She used some patterns of behavior in our social media. For instance, she had Milestones Monday and Throwback Thursday, and so she did themes on every day of the week and used those as a way to impart parent information and engage parents through social media, and then tracked the usage of families, and really encouraged our home visitors, encouraged them to share. Then we also linked through social media, linked families and those interested to our website. And so when they got to our website, to help with families understanding what virtual was, we provide a demonstration of a virtual personal visit. So families were immediately able to pull up that video, get a sense of what a home visit looks like. Then on our website, another personal touch is we provide pictures of every one of our home visitors and a little description of some characteristics of our home visitors. What are they like? What brought them? Just try to engage our families in that way. If you're interested, go to pat.usc.edu and check out our website. It's kind of fun. And I'm really, really proud of the way that that website was designed. We also are at PAT at USC Telehealth on Facebook, and you're welcome to come in and enjoy the social media presence that we have there.
Wonderful, thank you, Angela. Someone has asked whether or not you have any data about the number of families who are receiving home visiting who also care for other children in their homes. So maybe family child care providers that have other children in addition to their own in their home or in their family. Do you have any data or information on that, anybody?
So we don't have that for our virtual work, but we do have a number of families in our broader Parents and Teachers services who are also family, friend, and neighbor care providers or informal care providers, and that we have had curricula to support those providers in the past to help to basically work with them to support the interactions in their care and the quality of their care. And we have found for those informal providers that home visiting is a really strong strategy for that. And Angela and I have wondered about, could we do virtual coaching with family, friend, and neighbor providers? So unfortunately, we don't have those exact data for those that have been in our pilot.
Okay. I would like to invite Marge Edwards, who's a attendee on the call today, to see if she'd like to join in. I believe she has been unmuted so that she can do that. She was sharing in the comment box about how she's delivered services to families that she serves both in person and virtually, and feels as though the virtual delivery has helped improve her coaching skills and her working with parents. Marge, are you with us?
Yes, I am. Can you hear me?
Yes, wonderfully.
Perfect. Thank you, Sarah. So I am a speech pathologist, and I primarily work with families of children, birth to 3, children that have hearing loss. But the idea behind what I do is really coaching the parents to, take the lead and learn everything about hearing technology and how to work with their children. And I always thought I'm a pretty good coach, and I learned really quickly that doing virtual visits or telepractice, in my case, really taught me how to be a much better coach, because I had to think through what I was going to do, what I was going to model, how I was going to talk through things with families, and then kind of hand it over to them and give them that feedback as they went. So that was my experience as a professional. And the families also, I felt ultimately, once they really kind of caught up with the model, were much more empowered to come to the sessions and say, here's what I'm experiencing, here are some ideas, that kind of thing. So from my personal experience, that's just kind of what I've seen. So I think it's a great model. So thank you.
Wonderful. Thank you so much for sharing. And Marge, how long have you been, when did you say you began integrating the virtual
I've been doing tele-services for since 2008, so about 11 years. So, yeah, and then when I started, it was with very expensive equipment, and we had, dedicated IEP addresses, and so I'm so excited to see a lot better accessibility for everybody at this point, and I love what you guys are doing. So, thank you.
Well, wonderful. Thank you for joining in the webinar today and for sharing your experiences, Marge. And it gets back to your comments, get back to the question about the social norms and how those social norms are shifting, how we're getting farther along, that you've been doing this for now 11 years, and it really is becoming more of a standard practice. We had one other question about the fidelity of the model. If, do virtual services meet the model fidelity requirements that would be recognized by MICHA?
Right now, we're in conversations with them, but it looks like virtual service delivery right now does not meet the Maternal Infant Early Childhood Home Visiting MCV initiative. It is essentially where you're delivering the model, it's just through a different platform. So we're seeking to understand what level of evidence is needed in order to demonstrate that. So hoping to have more information on that in the coming months.
Okay, wonderful, thank you. Is that some of the research that Dorian is doing at USC? Would that speak to that as that work continues?
Yeah, I think our definite plan is to continue to research and study the impact we're having, and if needed, have a more rigorous research design behind this study to demonstrate impact, if it's in fact needed that's what funders want. So we really need to understand what funders want in order to help demonstrate that this virtual service delivery option in fact would meet fidelity and have parity with on-ground services and outcomes. So we're seeking to understand that, and we'll continue to research and study the impact that we're having, and just depending on the answer on the level of rigor we need to have, we might have to have a randomized controlled trial and more rigorous research design, which we would look to launch in a few years.
Great, thank you.
Sarah, one of the things that we have learned, and we maybe have understood this with Marge, is that in telemental health, they're implementing many evidence-based practices, such as cognitive behavioral therapy and others, and there hasn't at this point been a request to prove that they are meeting fidelity. So I think what we're again, this is part of norming, but it's also making sure that we do no harm, that services are effective, they are helpful, and that is important work to make sure that we can show that.
We've got another question about socialization. Has there been any research related to virtual socialization that can include all families from that group to network with one another, kind of building those social connections and demonstrating positive parent-child interactions?
At USC, we did demonstrate that group connections can happen and families are connecting with each other. We did not do specific research around that. It was more, is it feasible? Are families able and interested in connecting with each other? And we were able to do that. We had special groups, much like our on ground, where we had families that were primarily Spanish speaking, had carve-out groups. We had groups with different topics of interest and expert speakers come in. So we used a variety of things that we would use on the on-ground, and that engaged parents. It was interesting because we've had some group topics that families were so engaged that they stayed on for an hour and a half, and they carried their device around the home while they were interacting with each other. It's typical to on ground that some topics we didn't have as much engagement, and so it was really interesting to find the similarities that we have in our on ground affiliate work and our virtual work.
I know I would like to do a focused study like we did with screening as a component, another close look at a component, because there's a lot learned from online education and instructional design that helps us understand how to engage groups. And then we also have a lot of learning around group engagement and through our group series that we've offered here. So I'd love to combine all that together and work with experts and really be able to show some strong strategies and skills for that work.
So lots more to learn, it sounds like. So we continue to keep the chat box open if folks would like to ask any other questions. We've kind of walked through everything that people have submitted already, and I'd love to kind of go back to each of you and see if you have any closing thoughts or additional information you'd like to share before we wrap up the webinar. Would you like to start, Donna, since you're on the screen right now?
You know, Jess, thanks again for the opportunity, and as state entities and others think about how to address the challenges to access, we'd love to hear from you.
Allison or Angela or Constance?
I would just echo the same as Donna. Thanks for the opportunity and look forward to continued conversations. Maybe we can have a part 3 of this conversation in a few years when we have some more results from our hybrid evaluation and look about how we can scale that, talk about how we can scale that further.
Wonderful. We would be more than happy to have you back to share more of what you're learning as you complete those.
I would just say that as a longtime home visitor, families having choice and being able to, in their home environment, about how they access support, and us as organizations and providers, as we start to watch the behaviors of families, I mean, it's on us to be flexible and to be adaptable and to meet families where they're at. And by giving them access, choice and access points, it can really support families and de-stress families. So I really just kind of challenge us in the field to really keep that innovation spirit going, and let's keep talking to families about what they want and what they need, so that they can get the timely support in real time.
And Constance, any closing remarks from you?
Well, I saw one question in the chat around inquiries from local affiliates, and we have gotten inquiries from parents as teachers programs on the ground, from state and county departments from multiple sectors, as well as from other models. And I think that is why we're being as intentional as we can as we go through this process with this initial pilot during the first 3 years, and now an opportunity for the hybrid, and then a more detailed, a more rigorous evaluation to get this type of work and innovation cleared through multiple clearinghouses as a fundable delivery system for home visiting. So I want to thank the 3 trailblazers and thank you, Sarah, and the CGLR for the opportunity to share and get the message out about what this will look like in the future. And Parents as Teachers is committed to continuing to not only blaze this trail for the families that we serve, but for all of those that are in the business of supporting young families and children and impacting communities. So if we can use this innovation as a way to help more families thrive and expand the extremely limited reach that early home visiting has right now, reaching less than 3% of the families that can benefit most, I think it behooves all of us to seize this moment and utilize this kind of innovation.
Oh, wonderful. Thank you so much. We, given all that research shows us about how critical those early months, early days, early years are, we are very excited to lift up this wonderful innovation that you all are moving forward and share it with those in our network so that we can start closing those gaps. And so I just would applaud you for the work that you all are doing to look for ways to close the gaps and really support all children and families that need it. We've still got the contact information up on the screen, and wanted to remind everybody that we will be sending that out as a part of the follow-up email with links to our the recording and the slide deck so that you can continue to go back and listen to this again and share it with others. But I would also like to remind everybody that we've got some more great GLR Learning Tuesdays conversations coming up, including, although it's not on this screen, I would like to go ahead and let you know that on December 17th, there'll be another webinar that's relevant to this conversation as we have Gina Martinez-Ketty on the Parent-Teacher Home Visit Project, and she will be talking about the work that they are doing to reach and support families in the home as well. So I hope that you will all continue to log in and join us every Tuesday afternoon to continue this learning journey together. And thank you very much to our presenters, to Constance, to Angela, to Allison, and Donna. We really appreciate you taking the time to share with us, and to all of the attendees for joining in and learning along with us. Thank you all, and goodbye.
Thank you.
Thank you.